So we start discriminate between primary hypothyroidism and secondary hypothyroidism. As the name suggests, primary hypothyroidism means that the defect lies within the thyroid gland itself. Secondary hypothyroidism means that the defect does not lie primarily in the thyroid gland. It is somewhere else. Somewhere else means where? It is in the either in the hypothalamus or in the pituitary. The so-called hypothalamus anterior pituitary thyroid axis is defective. You people know that the hypothalamus secretes a hormone, TRH, thyrotropin releasing hormone, which acts on pituitary and stimulates secretion of TSH or the thyroid stimulating hormone or thyrotropin. This hormone acts on thyroid gland and enhances biosynthesis and secretion of thyroid hormone T3 and T4, levels of which therefore rise. We earlier considered this case of hypothyroidism with these clinical signs and symptoms, and we also found that level of T3 was low in this patient, level of T4 was also low, and TSH was high. So we considered that this is a case of primary defect in the thyroid gland. So it is a case of primary hypothyroidism. Thyroid gland, primary hypothyroidism, and we explained why TSH level was raised because T3 and T4 exert a negative feedback effect at the level of पिट्यूटरी एंड हाइपोथैलेमस दोनों को नेगेटिवली फीडबैक इनहिबिट करता है T3 and T4. So now in the primary hypothyroidism, अगर ये T3 and T4 levels are low, so this feedback inhibition withers off. In other words, pituitary, for example, gets disinhibited and starts secreting more of TSH. So that explains TSH level high. Now we consider another patient. In this patient, T3 level was low, T4 was low, and TSH also was low. Now this indicates that the primary defect is not in the thyroid gland. TSH level is low. अगर TSH level low हो जाएगा, so this stimulatory effect on the thyroid will go down, as a result of which level of T3 and T4 will also go down. So this sort of precludes thyroid gland defect. But how can we confirm it? This can be confirmed by giving TSH injection to the patient. If the thyroid gland is normal, so then after TSH injection, T3, T4 का secretion बढ़ जाएगा. And this is exactly what was observed in this patient. TSH injection resulted in raised T3 and T4. So that conclusively rules out that it is a thyroid gland defect. So the defect lies either in the pituitary or in the hypothalamus. How that can be done? How can we discriminate? This can be discriminated by giving TRH injection to the patient. Now, in this patient, no effect was observed on TSH secretion. Now, please see here. TRH injection, TRH stimulates pituitary, so TSH it should increase, but it is not increasing. So that means there is some block here. TRH acting on pituitary, this is blocked. In fact, pituitary gland, it has got certain receptors on which the TRH it acts and stimulates pituitary. So most likely these receptors are defective in the patient. So no effect of TRH means it is defect in the pituitary. Pituitary also can suffer from multiple defects, but here as we found that the defect is in the receptor. More details you can find out in case 40.1 textbook of biochemistry by Dinesh Puri, where it is given further details that the patient died of an automobile accident. तो autopsy में उसका pituitary was removed and radioactive TRH was added. Of course, after consent of the relatives, TRH radioactive was added and binding of this radioactive TRH to pituitary was observed and it was found to be low. And that conclusively proved that it is a case of receptor defect. So it is secondary hypothyroidism, defect at the level of pituitary, more precisely a receptor defect. Thank you.